And for more on this, we're bringing in our guest now. Gabriel Sayegh is the state director for the New York Drug Policy Alliance. And you know, Gabriel, before we get, I got a host of questions for you, but I looked at a Gallup poll in terms of American public opinion on this, on the issue of legalizing marijuana. And the only thing I guess I can compare it to is gay marriage when it comes to the velocity of public opinion on how much opinions have changed on this. You don't have to go back. They started doing this in '69. Just go to 2001. More than 2-to-1 Americans, 64 to 31%, were opposed to it. Now in the most recent poll, 58% approve it, while only 39% are in opposition. It's amazing how fast opinions have changed on this issue.
Yeah, it's a trend that is surprising to many. And the Gallup poll, as you noted, landed at 58% in support. Other polls have found similar support for ending marijuana prohibition. I think what's very clear here is that Americans are tired of these failed drug war policies, and they're ready for a new approach. And that's why I think we saw voters in Washington and Colorado vote to end marijuana prohibition in those states, tax it, regulate it, bring it under the rule of law. And then just this Tuesday, voters in Portland, Maine, voted to legalize marijuana for recreational use for adults. This is a trend, I think, that is increasing, and we're going to see more debate happen around our current drug policies and marijuana policies specifically.
Is this generational still at this point, Gabriel, where if we broke it down and asked people over 50 versus people under 25 their opinions, there's a huge divide, or is it narrowing?
That divide is narrowing, but there is still a divide there. I mean, the older Americans are less likely to support legalization of marijuana, whereas younger Americans are more likely to support. But what we're seeing is that as the baby boomers mature and they look at these policies, that they're increasingly willing to say, we've got to do something different here. This tired old approach, the status quo, has failed us. It's cost hundreds of billions of dollars. It's criminalized an entire generation of young people, mostly young people of color, and we're not gaining any of the tax benefits here. We need to do something different. And I think that's what these polls are indicating.
But do you think what's driving is more a resignation for people that if you can't beat them, join them, or that younger people say this isn't the demon weed anymore, the stigma attached to marijuana, whether it be through pop culture or whatever else, isn't what it was a generation ago?
I think it's a mix of things. I mean, for one, marijuana is the most commonly used illicit substance in the United States. 100 million Americans have tried it. And you have an increasing number of Americans who are using marijuana for medical purposes in the 20 states that have medical marijuana laws. Most recently, New Hampshire and Illinois passed such laws. We're considering one here in the state of New York. I think what we've got is a scenario where even people who are not marijuana consumers are coming to the conclusion that our current policies are broken and we need a new direction. Those votes that happened in Colorado and Washington in 2012 that legalized marijuana in those states, those were by no means pro-pot votes. Those were votes by voters in those two states where they were saying, we're tired of these policies. The people who supported those initiatives, police officials, government officials, leading business officials, and so forth, were not actually advocating for pro-marijuana position. They were saying our current policies related to marijuana are broken. And I think that's what we're seeing an increasing awareness of and an increasing public acknowledgement of. Even here in New York, there's a widespread acknowledgement and a growing consensus that what we're doing on these policies simply doesn't work, even if we don't have a consensus about what it is that we should do.
And to that point, in the viewing area tonight, we've got hodgepodge. In New Jersey, there is medical marijuana, but there isn't decriminalization. In New York, you got decriminalization, but you don't have medical marijuana. In Connecticut, both you have. But some of this, I think, has to do with optics. And if you could, Gabriel, either disabuse some of the perceptions out there or say what's real or not. Take Colorado and Wisconsin. Is the idea that you can walk right down Main Street on the sidewalk smoking a joint, or that you could have a bong sitting on in the park here? What can you and can't you do, even if it's legalized?
Well, in the states of Washington and Colorado that have legalized the recreational use of marijuana for adults, adults 21 years of age and older are going to be able to legally purchase marijuana and consume it. They will not be able to do that in public. Public consumption of marijuana will remain a civil offense or an infraction. People will not be allowed to do that. So if somebody was, in your scenario, sitting in a park with a bong or some other instrument to use marijuana, the police, of course, could intervene, even in those states where marijuana is legal. Where that consumption is expected to happen is indoors, in the privacy of people's own homes, in their private residences. There may end up at some point being places similar to a bar where someone could walk in and use marijuana in that location, assuming that they were a legal adult, 21 years of age or older. Similar to what we see in Amsterdam with the coffee shops, people may be familiar with that, but that has yet to be determined in those two states. So that's what's going to happen here. I think that the regulatory models that are being developed right now, and as they begin to come online, suggest that there's a great deal of thought and care being put into how this thing is going to be rolled out, and to ensure that the legalization of marijuana remains consistent with objectives of public safety and public health.
You know what I find amazing is some of the advocates to legalize it, who may have been opponents in the past, say, hey, let's legalize marijuana because it'll help us pay to build schools. And when you combine the two, building schools to legalize pot, they seem oxymorons. But that, I guess, is part of what the sell is, that you can not only tax the stuff, it'll be revenue generators, and look at where we're going to put the money. It's almost to a degree, maybe not a fair comparison, but you use lotto money to pay for state education, a sin tax, but if you put an application to it, it might be more palatable to the electorate.
I think that comparison you're making is actually entirely fair. I mean, think about what the cigarette taxes that we have here in New York, the highest in the nation, right here in New York City. I mean, those taxes help fund a range of social service programs and other important health programs. It's similar with alcohol taxes, or with the sin taxes as they're called, for gambling or lotto and so forth. The question is, what do we want to happen with the tens of millions or billions of dollars that are being generated right now in the marijuana market? There was a recent study done by the city comptroller, John Liu, where he estimated that there were tens of millions of dollars that were available here in the city of New York in the current market. But right now, we're not capturing any of those revenues for tax purposes because that market is entirely underground. It's a black market. And that means that there's tens of millions of dollars, potentially much more, that is changing hands all the time as people buy and consume marijuana. But our communities are not benefiting from that at all. And I think if we pose the question to New Yorkers, do we want to have access to tens or even hundreds of millions of dollars in tax revenue that could fund essential services for people? Or would we prefer that those funds go into the hands of drug cartels and organized crime? And I think the answer is going to be that we should capture those funds for tax purposes, because that money is there. It's a question of who it is that's going to gain access to it and utilize it, and for what.
Finally, I'll give you the devil's advocate question, and I guess there's two pieces to it. One is, you legalize this, the message you're sending, especially to youth, is the gateway drug, if you call that a marijuana here, it's okay, with the unintended consequences that may follow. And secondly, is this opening Pandora's box, where if you legalize marijuana, want to go down the line and legalize cocaine or other harder drugs? How do you answer those two issues?
Well, with the first, just from a scientific basis, there is actually no evidence whatsoever to suggest that marijuana is a gateway drug. It's a good soundbite for people, but there's actually no factual basis. It's simply not true. But that being said, the message that we're sending right now, particularly here in the city of New York, where marijuana possession is the #1 arrest, the message we're sending is that if you're young and black or Latino in the city of New York, it's entirely acceptable for the police to violate the law and violate your rights and saddle you with a criminal record for the rest of your life, even though young white people are much more likely to be using marijuana, and they do so almost without any interference whatsoever by the police. That's the message that we're currently sending. We're sending a message that says we're going to allow for racially disparate laws to exist on the books so that we have one set of laws for one people, another set of laws for another people, and where the distinction of those differences is based entirely on race and class. That's a pretty foul message, in my opinion. I think if we move towards regulation of marijuana, the message that we're sending is the message that we would send like with other drugs that should only be used by adults. We tell young people, don't do it. It's not for you. There's an age restriction here. We're going to couple that with prevention messages and prevention measures, education. We're going to make sure that when the stuff is sold, it's sold only to people who are legally eligible to purchase it. And that is a message that we can send. We've done it with other things like alcohol or prescription drugs. These things all have their own elements of problem to them. There's no doubt about that. But we have to constantly try to improve how it is that we manage those problems to ensure that we're doing the most possible good and the least possible harm. With respect to the Pandora's box question, it's interesting because when you look at the other drugs, cocaine, heroin, and so forth, there is a legitimate debate to be had about whether or not what we're doing currently is effective. And I think many astute observers would conclude that it's simply not. That doesn't mean that we would necessarily move towards legalization. And in point of fact, what makes marijuana stand out, what makes it a little different, is that it is the most widely used illicit substance in the country. 100 million Americans have tried it. There's simply not that level of usage at that scale for these other drugs that we're speaking of that people tend to refer to, heroin, cocaine, and so forth. The number of people using those drugs is much, much, much smaller. And so I think that's why marijuana, it's important to separate it out to some degree, because what's happening with it is unique in the American political and legal structure. There's really no other law that we have that is enforced so harshly and so broadly, and yet violated by so many Americans. And that's why marijuana, in some respects, has sort of leapt out from the rest of the other drugs. With respect to the other drugs, I think if nothing else, we do need to have a conversation about appropriate approaches to ensure that we're maximizing health and that we're maintaining public safety. But that does not necessarily lead to a conversation of legalization in and of itself.
Gabriel Sayegh, I appreciate a few minutes. Real quick, 5 years from now, we're having this conversation. Marijuana legal in New York, yes or no?
Well, hopefully medical marijuana at the very least. People who have cancer and multiple sclerosis should not have to suffer while people in New Jersey and Connecticut are able to gain access to their medicine. So at least in that 5-year period, we should have that here for New Yorkers.
Thanks again, Gabriel. I appreciate it.
Thank you so much for having me. I appreciate it.